Welcome to our practice session on CPT codes, where we will sharpen our skill and test our knowledge in medical coding. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In the previous video, we discussed radiological, burn excision or debridement and obstructive procedure codes. In this video, we will do some practice questions. So without further delay, let's get started. Our first question is, a patient received a labor neuraxial epidural for a vaginal delivery. The baby goes into fetal distress and a cesarean section is performed. Following delivery, the patient starts to hemorrhage. The physician decides, with the family approval, to perform hysterectomy. Code the anesthesia services. Option A with service code 01967 along with add-on code 01968. Option B with service code 01962. Option C with service code 01968. And option D with service code 01967 along with add-on code 01969. We will eliminate the option on the basis of correct service code. The first service code is 01962 anesthesia for urgent hysterectomy following delivery. Next service code is 01967 neuraxial labor analgesia or anesthesia for plain vaginal delivery. Next, add-on code is 01968 anesthesia for cesarean delivery following neuraxial labor analgesia or anesthesia. Next add-on code is 01969 anesthesia for cesarean hysterectomy following neuraxial labor analgesia or anesthesia. First, we will eliminate the option C with an add-on code, and according to CPT rule, we cannot use the add-on code without its primary code. We will also eliminate the option B with the service code 01962 as it is anesthesia for urgent hysterectomy. In option A and option D, which same primary code 01967, which is for neuraxial labor analgesia anesthesia for plain vaginal delivery. In option A, the mentioned add-on code 01968 is only for the cesarean delivery following neuraxial labor analgesia or anesthesia. In option D, the mentioned add-on code 01969 is for the cesarean hysterectomy following neuraxial labor analgesia or anesthesia. In the given scenario, the service performed is cesarean section along with hysterectomy. So we will use the primary code 01967 along with add-on code 01969. So our correct service code is 01967 along with add-on code 01969. Our correct option is option D with service code 01967 along with add-on code 01969. Our next question is, Dr. Sam, an anesthesiologist, provided 3 days of hospital management for epidural continuous drug administration. These services were performed after insertion of the epidural catheter. How should Dr. Sam report these days of care? Option A with service code 01996 into 3. Option B with service code 01996. Option C with service code 01996 along with service code 64999. Option D with service code 64999. We will eliminate the option on the basis of correct service code. The first service code is 01996, which is for the daily hospital management of epidural or subarachnoid continuous drug administration. The second service code is 64999, which is for the unlisted procedure nervous system. In this scenario, the service performed was 3 days hospital management for epidural continuous drug administration. So we will eliminate the option with service code 64999, which is for the unlisted procedure on the nervous system. The service code 01996 is designated for 1 day hospital management service. However, in this scenario, the service was performed for 3 days. Therefore, we would use this service code 3 times as indicated in option A. So our correct service code is 01996 into 3, which is for the 3 days of hospital management service. So our correct option is option A with service code 01996 into 3. Our next question is Dr. Brown, a surgeon, provided regional anesthesia and completed an exploration for a postoperative hemorrhage in the neck on the 60-year-old patient with moderate cardiovascular disease. How would Dr. Brown report his services for this case? Option A with service code 00350 along with physical status modifier P2 and service code 05800. Option B with service code 05800 along with HCPCS modifier 47. Option C with service code 00350 along with modifier P2. And option D with service code 00350 along with HCPCS modifier 47. First, we will eliminate the option on the basis of correct modifier. The modifier mentioned in the option are P2 and 47. Modifier 47 is typically used when the surgeon provides anesthesia in addition to performing the procedure. In this scenario, the surgeon provided both anesthesia and the procedure. Therefore, we will use modifier 47. It is important to note that when the anesthesia is provided by a surgeon who is also performing the procedure, we will never use the anesthesia code. Following this rule, we will eliminate all options with anesthesia service. After eliminating option A, C, and D on the basis of rule applied to modifier 47, our correct procedure code is 05800, which is for the exploration of postoperative hemorrhage, thrombosis, or infection in the neck region as mentioned in the given scenario. So our correct procedure code is 05800 along with SCPCS modifier 47. So our correct option is option B with procedure code 05800 along with modifier 47. Our next question is a 30-year-old patient suffers third degree burns on both arms and anterior upper trunk. Anesthesia is administered so the surgeon can perform debridement of the burns. Code the anesthesia services. Option A with service code 01952 and 01953. Option B with service code 01951, 01952 and add-on code 01953. Option C with service code 01952 and 01953 into 2. Option D with service code 01951 along with service code 01952 into 4. First, we will eliminate the option B because it mentions two primary codes 01951 and 01952, which we cannot use in one option as 01952 is for the additional body surface area. We will also eliminate the option D in which the service code 01952 is mentioned 4 times, which indicates it covers each additional areas. However, for each additional area, there is an add-on code 01953 which is given below the 01952. After eliminating option B and D, our next step is to find the correct percentage of the body surface area affected by burns for which the debridement is performed. In the given scenario, the percentage of the burn is not specified, so we will calculate it on the basis of extent of the body surface involved. The patient suffered third-degree burns on both arms and the anterior upper trunk. Each arm covered 9% of the total body surface area, totaling 18% for both arms. The anterior upper trunk covers another 9% of the total body surface area. Therefore, the total affected surface area is 27%. The primary code 00152 is designated for area between 4 to 9% of the total body surface area. For each additional 18%, we need to use the add-on code. Since the total additional area is 18%, we will use the add-on code twice as indicated in option C. So our correct service code is 01952 along with add-on code 01953 into 2. And our correct option is option C with service code 01952 and add-on code 01953 into 2. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock exam related questions and notes, email me at my given email ID.